When we talk about medicinal cannabis, this is what most of people think of. However, it's more like this. Cannabis oil, or CBD, is a type of cannabis oil, a chemical found naturally in cannabis plants. CBD doesn't cause the high feeling often associated with cannabis, but where CBD products are used most is in treating patients with chronic pain. It's relatively early days in the research on CBD products in managing pain, but what has been done has been remarkably promising in proving its effectiveness in reducing pain, inflammation, and the general discomfort caused by a variety of health conditions. What's great about CBD is its existence as an alternative for patients who have chronic pain and rely on medication like opioids that can become habit-forming and can create even more side effects and so on. While more research has been conducted to truly confirm the benefits of CBD products, what's the fuss about? Well, CBD. It's thought interacts with the endocannabinoid receptors in the brain and immune system. Receptors are tiny proteins attached to your cells. They receive signals, mostly chemical ones, from different stimuli and help your cells respond. It's this response that creates anti-inflammatory and pain-relieving effects that aid pain management. So anyone who has, for instance, chronic back pain could benefit from CBD products. In 2018, a review assessed how effective CBD worked to relieve chronic pain, including cancer pain, fibromyalgia, and neuropathic pain, and concluded that CBD was indeed not only beneficial in managing this level of pain, but also didn't cause any negative side effects. More research is needed into the anti-inflammatory and pain-relieving effects of CBD for people with arthritis, but again, so far, so good. Cancer patients also use CBD, with research on mice showing it can lead to cancerous tumours shrinking. But human studies have more sensibly been used to investigate the role of CBD in managing cancer-related pain. CBD can also help with reducing chemotherapy side effects, such as vomiting, pain, and lack of appetite. And one study in particular showed that using the extract relieved pain more effectively than if the patient had relied solely on opioids. There's a way to go before we can say for certain that CBD is going to be of benefit. But based on research done to date, and with so many conditions from migraine headaches to MS, causing high-level chronic pain with additional pain and symptoms from treatment, I personally have a lot of faith in hemp-derived products emerging as a major force in managing chronic pain in ways previously thought impossible. As always, why not talk with your doctor to see if it's an option for your condition? Thanks for watching, guys, and don't forget to like and subscribe, and I'll see you next time.